I hope nobody's gonna sleep. You guys want to just stand up and then you sit down. Stand up for like a minute, stretch. Thank you. Down. We're gonna go straight to our next presentation. And these individuals are the same people that we met yesterday, plus maybe one more that is new. And they're gonna give us a presentation on mental health and the importance of taking care of ourselves and taking care of our mental health so that it doesn't reach to mental illness. So Miss Julie is the one going to present, she's the one going to moderate this panel, but I think everybody been seeing Julie around here and nobody really, we didn't really do a formal introduction who she is and what she is passionate about. And so I'm just gonna read a quote that she sent us about herself. So here it goes. I am a daughter of Equatoria, a wife, a mother. My professional background is in human services, focusing on disability and community services, where I have occurred over 15 years of experience. I completed a diploma in disability and community studies at a college in Red Deer. And then she went on, continued with education, and she got her bachelor degree in child and youth from the University of McEwen in Edmonton. And she said, I am privileged to talk to you today and I'm eagerly anticipating to interact with everybody. Something that I think I need to add on this is that Vicky is very passionate about our community. If you talk about Equatoria, if you talk about South Sudan, and you need help, and you call her, she will be right there. If she doesn't know something, she will say, I'll get back to you. She'll do research and make sure that she's involved in whatever that is going on. And for that, I am so honored and proud to call her a sister, a friend. Ladies and gentlemen, please welcome Vicky.
Oh wow, thank you Acharya for that wonderful introduction. I always get nervous to do a presentation, but this presentation in particular touched my heart. I was approached about a week ago, just a week, that I need to prepare something to bring to the conference today. I searched within me to see on how I will speak to my people and how best can I bring that information, not only using the medical terms, but how can I bring the message to the more basic, and how can I relate or the way I present this topic that each and every one of you can relate to it. So I know that back in Sudan, you know, stories are passed on through those kisata gagu and supilende. Arabic taban kaman. You know, I've been here for a while. Arabic na wulu na masida de kala sukaman. But Arabic history Lisa. So we are known to tell stories, and I know that if I bring it through storytelling, we are going to be able to remember. Isn't that right? Perfect. I remember when I was young, back in Sudan, my mom never went to school. She's not educated. And I was born in a family, Al-Kebir, but I was one of the youngest. There was a day we were playing with my siblings, and I do have an elder brother who is so naughty. He is very stubborn. He hits people. He does crazy things. And there was a day we were playing, and he turned around and he saw Linda of Africa, Guinea Sudan in particular, Guinea Mojunun. The Fizon Mojunun, Fibobrasaka, Ogilega to Hayat, Masualto, Fidaha, and Gumasa Logili Bizede Sual, and Gisinto Waskan, and all of those things. And my brother, Obada Naduma, Mama Talaino, Fizon Mojunun, Yaragilega Waskan, Ogakuru, Akita Bobrasaka, the Numa Taija, Obanaki, when it quiet. You know back home, Umahad, you need that look. When they give you that look, you know you're in trouble. There's something that is going to come later. So my mom gave that look. I saw that look, then I'm like, I better get out of our way. So I got up and left. So my brother wanted to talk much. My mom gave her that's a stronger look, and she went back inside. And then Umata later on came and said, Ita is old lady. Then will it so? You have no idea. So no hasil is old. Zode mo in debate, who in the mara, who in the yam. Hanna marof. So ita can goes on mojunon pesika, mata wonu suseli, as a no basma. Ita futu sika taki. Because for junior, ita marof should be galata. Ita marof sunu be hasil letter. Ita marof kan mahasil letter, ama lezol tani fi usra taki fi family taki. You have no idea. So whatever they kill him, that you know what it is. Fi haja gina is silik. And now haja silik there, silik. A wire, the thin one. Whatever they kill him, that they love stories. So what they kill him, it ain't good so much you and no kuru in this ship. Yana zaman tani silik de kanyagata. Kalam kalas karamu, silik de mohin. So that analogy of Umataike and silik, I never understood when I was young. But fast forward, I came to Canada. I picked interest in the human services career. And why I did that was because my dad actually got stroke because of high blood pressure, and we became his caregiver at a certain point in our life. So I made it to me that I would love to help other people. When I help others, then that in turn gives me a sense of gratitude. It gives me a sense of fulfillment, a purpose. So when I grow up, I'm here, I'm in school, so I try to pursue those so that I can understand, so that I can be helpful. So that's when the civic story resonated with me. I work with people with disability. I currently hold a position as a caseworker. I support people with all sorts of diagnoses. And sometimes when you do that, you kind of reflect on what brought you, what grounds you as a human being, as a worker. What is that one thing? So when I see individuals that are struggling, whether with any mental issues or concerns, and that story comes. So my people, there's a very thin line between sanity and insanity. And I believe the story of the civic is no longer mine. It's already going to be in kitchen tables. You guys are going to speak to it about it to your kids, or to or any other situation that may happen to you that may come into your mind. So mental health, especially Anna Jamin Shankla, Jere, Antinogin folk, and all those things. We may think that, we were surviving back then, but here, with the running around, we spoke about yesterday and today, that sometimes we don't even have the time to sit back and reflect because we are on the fast run, you know. So we had resilience then, but how come sometimes we struggle with things here? How can we look deeper into ourselves and start to change the path so that we can be supportive? I can be supportive to you, you can support me, I can come and realize that actually you are my safe space. If you are my safe space, I can come and talk to you. Hey Joyce, this is what I'm struggling with. I'm not sleeping these days. I have headache. I am feeling this or that. Then somebody, a sister or a brother or a family member or a husband will turn to you and say, hey, I'm here, open ears. And sometimes you want somebody just to sit there and listen to you and understand what you're going through. So, mental health, and I pulled that called Our Mind, Our Rights. World Health Organization has recognized, has declared mental illness to be a right. And if it is being declared, it's something that you and me can actually every day take an action towards maintaining our wellness. Because when you're completely healthy, you'll be able to help your family, your wife, your children, extended family back home. Be productive at work. Okay. So an overview. What's mental health? Mental health is the overall wellness of thinking, regulating feelings and behavior. But when that definition takes a shift, that's when it becomes a concern. Mental illness, also called as mental health disorder, refers to a wide range of mental health conditions. Mental health condition may affect how well you maintain relationship with people that are in your life, whether it being a relationship at work, in your house, functioning in social setting. You know, when you're struggling with things that are deeper, sometimes people cannot even cannot sit still. You tend to fidget, you tend to do other things that may be destructive. Performance at work or at school will be reduced. Learn at a level expected for your age, at a lower level expected to your age. So you're not functioning at that level of your cognitive level. Participating in other important activities. So you will be struggling in a lot of things. So when we become aware of what we need to do, then we will be able to see the indicators early and then take an action. For example, when we look at the symptoms, when we start to feel sad, you know, just by a show of hands, how many of us have ever felt sadness or maybe has hanged around for a day or two? How many of us? I have, and I still continue to. So when we start to notice those sadness a day, but then it progresses to 2 days, to 3 days, to 4 days, then we need to know that it's not right or it is not my normal state of feeling. Then at that time we may need to take an action. So it's not only about sadness, confused thinking and reduced ability to concentrate. There are so many of them and we are not going to go through all. But I want to mention to you that some of the symptoms may not come in terms of maybe reduced cognitive ability or reduced lack of sleep at night or not being able to interact or participate in activities in your house or being cooking or whatnot, but sometimes it comes in a different way. Headache, stomach ache, so it will be more physical. So symptoms, we continue on symptoms. Sometimes symptoms of mental health disorder appears as physical problems such as stomach ache, pain, or this. So I want also to bring a story again, because I believe that when we bring a story, we tend to remember things better. And I think this presentation made sense because a couple of months ago I was actually struggling with mental health concerns, not mental health. I was struggling with mental health concerns. And my symptoms were not lack of sleep or my cognitive being confused, but my symptoms were more physical. I was getting migraine headache beyond the normal that I was getting. I was getting pain of joints. I was looking in the wrong areas, not really recognizing what was going on within me, although I was not feeling that completely well. So I took a step further to investigate why that. And I went and talked to my doctor, and we started looking into different ways of how we could root that out. So when do I see a doctor? We see a doctor when that normal is not normal anymore. You know, the sadness is hanging around, the season of silence is hanging around, it's taking longer, you're not participating in your household dinner, you're more in the basement, you're more secluded, you're not talking much, you're not communicating, you're more reserved, you're more protective, and sometimes people will say that I just don't want to talk, or I don't want to interact. But when you look deeper, something is pushing you to do that. And I think for you and I, it's when do we take a step and say, hey, this does not look right. So if those symptoms is shifting, then we know that things are not going right. We may want to go and see a doctor. If you have suicidal thoughts, sometimes with stress, you know, that feeling of unworthiness, I'm not worthy. I had that feeling, I felt like I'm not good enough, I'm not a good mother, I'm not a good wife, I'm not a good daughter. So some of those things could come in those ways, and when you're feeling those are not just thoughts. They are things that you need to take action on. Speak to somebody. Speak to your wife about it. So Rujal, can you go through all those things? You will see them basement. Raja Bijami Shol, Obes Burua basement, Kutu television on, Obai Nukura, Lekin Ogi cover. Issues are really is taking place, you know. So we need to, it went further. So we need to be able to catch ourselves and say, hey, what I'm doing today is not normal. I need to take a step, or I need to talk to somebody, or I need to speak to a friend. What bring those things? What are some of the things that could have caused us to have those indicators of mental health? So when we look at inheritance traits, you know, some of us, we have family members that are struggling. Like for me, I have a dad that struggled with, diagnosed with stroke. Similarly, I now take extra precautions to make sure that my blood pressure is checked regularly. I visit my doctor regularly to make sure that my health is going well. I work out, I go for a walk daily, I eat healthy. I take precautions that will help me stay longer so I can see my kids. Similarly, when we look at mental health, sometimes it runs in families. So we need to look closer, and if we have that, we start to take precautions in who we are so that at least we can better prepare for what is to come. Environmental exposure before birth. So, you know, exposure to alcohol and toxin in the environment. But when we look deeper as South Sudanese, let's look at the war that we have all been through, the trauma that we have all been through. What is that doing to you and me? You know, those traumas resonate in a different way when there is other indicators that will help trigger whatever that trauma is. So we need to recognize that you and I came from a very hostile environment, and sometimes being here, working, not engaging with families, not engaging with kids, are not taking care of ourselves in regards to food. Sometimes we find ourselves actually that can trigger our mental concerns to push us to either depression, anxiety, or any of those mental health conditions. Brain chemistry. So again, not taking care of ourselves will all result to that. So what are the risk factors? Because we being South Sudanese, being exposed to a lot of wars, being exposed to a lot of situations that were not really helping us sustain the most quality of our life, will contribute to who we are and how we can maintain our mental states. A history of mental illness, like I said, in the family. So if you have those could be a risk factors that you could start to look into and to start to take precautions earlier. Stressful life situations such as financial problem. Issues with finances in this country pushes us to be stressed, to think, to worry. An ongoing chronic disease. So if there is somebody with diabetes or somebody with any other condition, whether being addiction or eating disorder, all of those things. Brain damage, is also an indicator that could put you at risk for mental health. Use of alcohol, recreation drugs, childhood history, abuse and neglect. So kids that a lot of us grew up during the war without our parents being a part of our life or taking care of us. So some of those things will not help, but contribute to us being susceptible to mental health concerns very easily. So it is good for us to pay attention to those risk factors so that we can work towards the prevention. Few friends or few unhealthy friendships. So we need to look also into the circle that we're hanging out with. Who are those people? How are they contributing to our wellness? Or they are pushing us to unhealthy decisions. So we need to take that into consideration. Previous mental illness. So if you have been pre-diagnosed or went through stressful situation and whether dealt with anxiety or phobia of any kind or depression of any kind of you've recovered, you could be susceptible to developing even a bigger. So paying attention to your body, learning what your risks are will help you prepare and take care of yourself so that at least you don't land into a full-blown mental health issue. How to get mental health help? Some people worry about asking for help because there can be a stigma around mental health. So when we look back into who we are, mental health is not something that we as South Sudanese actually talk about. It is something that when you bring, just like the story of the Mujnoon, you'll be referred to as Mujnoon. I just confess that I have been struggling with mental health, and not a lot of people here actually know, not even my friends, that I've come to and spoke about my struggle. Simply because I fear that judgment, I fear that stigma. They will say, oh, look at Vicky, oh, Mujnoon, but is it really? Maybe I'm struggling with an issue, a particular issue, because of the risk factors that I had, where I came from, the war, so many things in the family, issues here and there will push me easily to that. So my fear was, how will you people even look at me later? That was my fear. But I believe the timing was right for us to start to speak about this and to look at somebody who has really gone through and is still going through, because mental health is not a one-day fix-all. There's no pill that you will get today, it will fix that. They will give you a pill that will help control, but cannot fix it. So they believe that asking for help is admitting that something is wrong. We all, and South Sudanese and making kafal, oh my God, and I can admit I've got a little, and I just struggle my day, my dark, not be judged, and so they became feeling anima healthy or animal junoon or something like that. Some people worry about how others might see them, like me. I worry about how other people will judge me. Asking for help means wanting to change or take steps towards your new health. Celebrate the courage it takes to speak up, because not so many of us can even take that minute to say, I'm also struggling with this, or I'm suffering with this, or I'm not sleeping well, or I'm not eating well. Those kind of concerns. Building your team. So the first step might be challenging, but finding where to get assistance is a great start. For me, the step was to sit my husband down and let him know that I'm actually struggling. I cannot sleep, I cannot eat. I felt like I was on a fast-moving train that never stopped. And I'm constantly, I work on a computer most of my days, but sitting on the computer felt like my whole world was crashing. But sitting him down and letting him know that this is how I'm feeling opened the door for communication. He was able to be empathetic, he was able to listen, he was able to help me start to take steps that will help me towards my health. So talk with supportive friends and family. So I talked about my husband. Share your feelings with them and let them be a part of your team. So my husband is part of my team. I have few friends that I've spoken to. They have become part of my team. Then I consistently go back. They consistently check with me, Vicky, how are you doing today? How was your week? How was your weekend? Talk to your family doctor. So that was another step that I went and disclosed to my doctor. This is my struggle. Then we start working on a plan that would work for me. Connect with community mental health clinics or organizations like the Canadian Mental Health Association for information, support, and advice. I am going through counseling, and I was referred to that mental health community organization through one of the hospitals here in Edmonton, because my child was going through a health crisis, and because of that, there's a team that supports him, so they have to also support the family. So I was referred for counseling through that to a specific community mental health clinic. So I still go there every day, and it is working. I still work, I am still a mother, I am still a wife, but going to that clinic, I can sit down with the psychologist and we can talk. We can talk about things that what are the strategies for me to keep myself busy, to make time for my family, to take time to go for a walk, to make time to cook, to make time for me, to be selfish and start to take myself first. It is a journey that I'm still working on, but they became my team. And then a call a hotline. Some organizations also offer support online or through text messages. Here in Alberta, we know I have them later, I will speak to. But a lot of, after COVID, a lot of employees, employment services here in organizations, or whichever ones you're working with, they do have a program called Employment Assistant Program. That is actually an amazing, but it's so of hands, who knows about that program existed? I actually utilize it. When I first could not sleep, could not function, could not do things, I'll sit on the computer and not even do anything. I access that. It's an anonymous, as long as you work with the company, you and your family and your children and your extended family can get help, can get counseling, can get support through those programs. I accessed that before I was referred to a formal clinic and had a counselor that I continuously continue to visit and work with towards my health, towards my wellness. And it is a journey. So, Anama Mojuna again, but it is a path that I am navigating, and I think by bringing this to all of you, you guys will also know that it is a path. Because sitting there, very thin, anything can happen. You may be healthy today, and tomorrow something may happen. So, how to get mental health? Oh, I was going back, my apologies. How can I help that last one? So I spoke about my husband. When I came to him, he really supported me. He was there to listen. He never judged me. He never pushed me to do something beyond what I have acknowledged within me. Because at the end of the day, you don't want a partner that will come and dictate. You know, when we are going through that dark time, and I can attest to that, being a part of somebody that has gone through that recently, you are in that dark corner, you don't want this in your ear. You want support, you want heart, you want empathy, you want love. You want them to recognize that you move at a certain pace that only you will know. And that pace could be here, or there. And if you start to take this big of a step, it is a good thing, and they need to celebrate that with you. So help people that are in your family at their own pace. Respecting them and their wishes, very important. Don't forget someone to choose a particular treatment. There are so many treatments, we'll talk about them. Help them choose what is best for them. I was able to make one for myself that is working for me. Some services are helpful for caregivers, support groups. So like for my husband, he's very good. He said he has a church network that he's connecting with, the pastor and working with. He doesn't want to go to a connect group or, not that he's a my care provider, no, but he's a husband. Sometimes it can affect husbands or wives as well as their partners go through a mental health crisis. Prevention. I will speak that one directly about me. What am I doing? I get routine medical checkup. I go to my doctor. I am on antidepressant. So I go to my doctor. We speak about the dosage. This, what is working, what is not. So you have to know. You do your research. You speak to people that are knowledgeable in that area. And you work with your medical practitioner, the doctor, to define what is best for you. And sometimes you change medication on this. But medication is not the fast approach. Getting help when you need. So for me, there are some days that I am low. I will tap on my husband and say, I need you, I'm feeling this. So one of the things that he has done actually to help me greatly was that when I'm low, I will let him know that I will signal to him, and he will remind me of who I am. I am a strong woman, I'm educated, I work hard, but when you are going through a dark season, you actually forget who you are. I actually forgot who I am. I remember and thought that I am stupid, I'm not good enough, I'm dumb, I am not beautiful enough. You know, those kind of things will start to, the voices will tell you, and you will be in that rabbit hole that you cannot pull yourself out. But if you have somebody that can tell you, oh my God, this is who you are, this is who I fell in love with, this is who I love, this is the mother of my children, this is, those things, you may think that they're just words, but they're powerful. They're profound, and he helped drag me out of that hole to who I am today, that I can stand here and speak about it. right? Take good care of yourself. So I have umbarika kunayo na derwa fi hajat kenisa de baba another tala minister. I'm not going to do that, but God has become a channel that actually gave me, it grounds me. It gave me sense of purpose. It gives me peace, and prayer works. So I would pray a lot. I would ask God. And when we look at the Bible, Moses, when he was in the wilderness, he struggled with mental health. And who did he cry to? He cried to God. Although God may not appear in front of you in physical, but there's that sense of peace that will come and fill you up. So prayer has become something that I do. Journaling, I do journal. I work with people with disabilities, so I know all of the different techniques that can bring me to, can regulate me. So I do a lot of deep breathing. I don't know, we don't have the time, but I do deep breathing, meridian tapping, so many things that help me stay grounded. I speak to friends. I have friends. I cook. I love to cook. So some of you can come visit my house. I love to cook. So I cook Sudanese mola kodra, mola shunu, mola weka. So those brings me joy. So as simple as those things are, they actually gives you purpose. And then my husband started gardening. So as a caregiver, he's not that he's taking care of me, but as a husband, he found something that brings a sense of purpose for him. So gardening. So walking, going for a walk. We go for a walk daily. We do things, I go with girls out. So you can find something that will be meaningful for you and will help you stay grounded. I'm going to speak to that. Cause of classes of mental illness, so many of them. I'm not going to speak to that. Treatment, I spoke about medications. But psychotherapy, the talk therapy has been really tremendous. Anna Sudanese and Kafu therapy. When you need it, you will know. And it's not a bad thing. You know, I'm standing here, I still go for therapy. And it's helping me regulate and take care of myself. If you need to do that for your wife, for your children, for your family, for your generation, for your legacy, do it. Brain stimulation, that's extreme for cases that are more severe, and that will be the time for it. You'll talk with your doctor and determine that. Hospital and residential treatment, of course, is the last resort, but we as Sudanese, we don't want to get there. If we do those simple things, engage, it will help. Recommendation, I was asked to speak to this different section of recommendations. So for individuals, connect with your family, speak to your husband. You know, the closest people to us, the Bible actually tells us that what is in you is greater than what is outside. So if you search inside, within your house, you may find the support there. For youth and adult, friends, networking, connections, staying active, sports, sometimes keep our kids away from trouble. So find a purpose, give your kids to engage in an activity that is meaningful to them. And that means we need to communicate, we need to talk, we need to ask them, we need to see what works for them. Our families, as a husband, as a wife, as a mother, listen to your kids, sit down during the dinner, ask them what's going on, and help define that and find a path. Find an activity that works for the whole family. We go bowling sometimes, we go to the park to walk. All of those things help. And for ESSCA, my recommendation would be is that how can ESSCA, I know that ESSCA doesn't have an office right now, established, right? If they do, how can they lobby, for example, those in Alberta, I'll speak about that, through AHS to bring workshops to the community, to bring workshops about youth mental health, to bring workshops about aid, different courses that will help bring awareness, that will help train all of us. AHS offers a lot of those trainings, but if we have ESSCA as a body lobbying that or advocating for us to have those trainings within our community, I think that will bring knowledge to us, because the bigger words may not matter, but what matters is the little things that you and I do in our house matters, or how our husbands take care of us, speak to us, and encourage us. Those are the things that matters, because when we start to take care of those little things, our mental health start to really be sound, and our wellness will shine through, and it is through those basic things. That brings me to the end of my presentation. I am actually also moderating, so we'll give questions later. But
so the next presenter is, we heard from him yesterday. He talked a lot about the medical part of our struggles, and today he's gonna talk about the mental health and how we can keep ourselves safe and healthy, and so we can be the best of who we are. And for us to do that, we need to be, it has to be a holistic approach, where we can all be in a place, your mental health is good, your physical health is good, sometimes your financial as well has to be good. So, but we're not going to touch about the financial today. But for now, I'm going to invite Dr. Victor to come up and give us his presentation.
Because what Vicky presented, whatever scientific knowledge we may share here will not be compared to what she shared today. And we have a saying in Arabic that asal al-mujarib qabla al-tabib. But she has really given it all, when whatever it takes inside the person with relations, and that's what a real mental health clinic. If we are following her very well, most of our mental health issues we will be able to manage it. So thank you very much for this presentation. Today we are going to continue with our presentation here. That is the second day, is substance abuse addiction challenges. The objective of this presentation is as follows. We want to define substance abuse and its consequences and effects on our health. We know that substance is something that affects our cognitive function as well as neurological functions. So we want to see how it will affect our body. Then we want to understand the implications of substance abuse and addiction in relation to physical health and chronic illnesses. Physical health, that means things to do with our other systems, our heart, our liver, our kidneys, our brain as an organ, not as a functional part, which is a mental part of it. And we want to know about, I want to formalize ourselves also with the necessary ways of calling for action. How do you mitigate and as well as face those issues and control them, and where to look for help? And I think the previous speaker also mentioned things about that. So I would like us to look a little bit at this chart here. It is not something that we should concentrate much on it. The title there is, how are we doing with substance abuse? That means we see in the other groups of ethical groups, how do we do? You see there, you see that group there, this our group, black people. Then we take those substances. See opioid compared to whites and natives, we are almost in the middle here. Then we see heroin. Our heroin is somehow whites are higher than us, but we are higher than these groups here and there. Then cocaine, we are somehow more than the whites, but also more than the other groups. Then when you go to other prescription opioids, we know that also in the hospital they were given this medication, and I could be an example of that, but I refuse. I'm somebody of 24/7 pain. My body is all over pain, but I refuse to take those medications because I know at the end of the day, I will end up somewhere on the street or something like that. Then you go to this synthetic opioid. They are opioid but synthetic, and these things that coming every time in different forms under different name. You think they will tell you that is good one and it is better, but it will take you the same way. And also the same thing here. This psychosomatic substances. We see that we are somehow not bad, but we were addiction to ايزول addiction بقدر لقيتها لأنه بدا بسيط جدا بطريقة سهل جدا يعني زي هنا addiction ده هو نوع من دعم للبزنس. في ناس شغالين في مجال بتاع بيع المواد بتاعت المخدرات دي هم بيجذب انت بطريقة بسيط جدا يمكن جرعة واحد يعني أغلب المخدرات دي just one dose, you are already hooked up to continue. Just one dose. As a kid, we have to be very careful about our kids. Sometimes it will come in form of candies. As a kid, you see even in this Canadian culture, the culture, during the celebrations, treat and what? Huh? Yeah, the Halloween. That you have to be very careful in those aspects, because somebody will just in the neighborhood there, he wants to get some kids to hook them up, give them some sweets. Just one piece of sweet, the child is already hooked up, he will be looking for it. So to get addicted is very, very easy. Sometimes you don't know. That means you don't plan for it. And you get yourself, you are addicted. This chart, and I hope it made some sense of how we can discuss the substance abuse. Yeah, what is substance abuse? They say substance abuse is a harmful or hazardous use of psychoactive drugs. The word drug there I just put also because it's a common word that people use, but it's still, I prefer the word substance because the word substance, that it is any substance that can affect your brain. Not necessarily pharmaceutically manufactured or something like that. Anything that can affect your brain function or any function of your cognitive, things like that, this is substance. So when you use it, of course people use it for different reasons. Use substance for different recreational reasons. Zolder kayif, zema gionzu. Zolder kayif, وقوم ياخد حاجات ديل وبعدها قلنا من كيف ويصل مرحلة ثانية ويكون بعدها وبقى ما بقدر أعمل أي حاجة بدون تكييف ده وبعدها خلاص وبقى وصل في مرحلة ثانية وبقى addicted لنا. وأغلب السبستنس أنا أقول الكلام ده مواد غير مشرعة يعني حاجات ما قانونية عشان كده they call them illicit drugs or illicit substances. دائما في قوانين تدول كتير لكن أنا شايف كندا هسه بيرو شوية legalizing others. أنا بفكر بانجي هسه بقى ما illicit يعني you can use it في السكة في أي محل ما بزول بحصلتها، ولكن في دراسات ماشية هسه يمكن نمن بيجي فوق نظر فيها حوادث كتير، مشاكل كتير، إجرام كتير، قتل كتير، في بعض منه related باستعمال بتاعنا. لأنه واحد حاجة من الحاجات البنك عمله بنك بيدرين your ability to judge. أنت ما بقدر judge هل ده غلط ولا صح، أو even في المسافة. يعني مثلا زي ما بقولنا نقول سواق الجيرو بنك ده سواق كويس، عربية كرة بسرعة وفي النهاية كان عمل حاجة يمكن الناس كلهم يموتوا. لكن هنا اللي بيحصل انه هو ما بقدر يعني مثلا كوبري لسه في زي باب ده كوبري بظاهر لوين وباخد لفه وخلاص حصل مشكله. فبنك عنده تاثير في دراسات يقولوا دايرين تشوفوا فعلا بنك حاجه كويس تخلي الناس كله يستعملوا ولا تخلي رجع ثاني يكون ما قانون يزول يستعمل. السبستنس ابيوز له تاثيرات اللي هو في نهايه المطاف انت بتقول انه بيأفكت physical health as زي جبلنا mention your brain, your heart, your liver, your kidney, and mental health which is your cognitive ability اللي هو القدره العقليه. انت بتجادج situation كيف، انت بتتحرك لاتجاه مشكله كيف، وانت بتشوف حتى بيقولوا شو intellectual abilities بتكون impaired sometimes اللي هو القدره انك كيف تحكم الاوضاع اللي حولك. يعني ممكن زول I'm sorry to say that زول يقول هنا ده خلاص الفاكولتي بتاعه mental ability بتاعه في faculty abilities ده بقى ما شغال. يعني هو بقدر يفرق يعطوه صح ويعطوه ما صح، وده أكا وضع زول كان وصل فوقه يعني. وبرضه ما ننسى relationship زي ما ذكر قبل شوية، مشكلة الريليشن شيب ده فيري مهم. يعني انت من بداية في بيت ما سباوس راجل ما مرة، يعني هم ذاته بينسوا أهمية بتاعهم لبعض. عشان كده بيكون في مشاكل، يعني في إهمال وفي النهاية يمكن بيحصل طلاق. ناس بيكون ما عارفين الطلاق ده، يعني هم قاعدوا ما في حاجة، لكن في مشكلة هناك في واحد فيهم يمكن قد تعاطى مخدرات أو addicted to this substance. وبالتالي overall being زي ما جبال also سمينا حتى الفاينانس زول الاديكتد ده الفاينانس بتاعه ما هو بس، وممكن يدفع اغلى ثمن عشان يحصل للمدى اللي هو بيجي. كان يال ما ياكل البيت ده ما شغلته، المهم هو ده كيف. هنا بعد انواع المخدرات نبغى في حقن هناك، في السجاره هنا، وفي القليفو، وفي الشموع هناك. والليست اللي هناك this list of how people administer or the rules that they take this thing. أنا بفتكر الليست ده مهم كلنا نعرف، حتى ال parents كلنا نعرف الليست. لأنه بيكون في معك زول في البيت بيستخدم واحد من طرق ديل وقاعد يتعاطى المخدرات بتاعه وانت ما بقدر اعرف. انت بتفكر قال لي لو بيجامو بتفكر كده، لكن هو كنت بطريقه ثانيه. واحد من ديل كاتبون الطرق اللي هو قاعد يستخدم. يعني من فوق هناك ممكن يستخدم عن طريق الخشب، وفي ناس عن طريق الصفه من فوق هنا، وفي ناس عن طريق الحقن، في ناس عن طريق الجلد، في ناس عن طريق بتاعت يشموا، وفي ناس تحت اللسان وتحت الجلد، وبما انه حتى في الفتحه الشرجيه او في المهبل. ده مهم جدا. يعني انه ما نفوت ساعه يقول ما قاعد يحصل، ممكن قاعد يحصل. I'm sorry to say that يمكن المرة بتاعك في البيت قاعد يستعمل انت بكون ما جايب خبر، الراجل بتاعك في البيت قاعد يستعمل انت بكون ما جايب خبر وامور ما ماشي كويس. نيجي نشوف الحالات فعلا استخدام بتاعت السبستنس ده او substance abuse. What does it do? The implications of those substance abuse. We have physical health. Physical health, as we mentioned earlier, these are the things connecting with our organs and systems. We have their cardiovascular problem. The مشاكل بتاع القلب والأوعية الدموية. مخدرات substance like cocaine and methamphetamine ده ممكن يعمل لنا مشكلة في قلب وقد يؤدي لحالة ممكن يعمل لنا مشكلة في القلب برضه يؤدي لأريثميا اللي هو ربربة كده في القلب. يعني انت الضربات بتاع القلب ما منتظم، قد تكون زيادة أو قد تكون أقل أو قد تكون فوق تحت. يعني ضربة بيجي وبيرجع وقد تكون بيجي بقطع منتظم أو بقطع بطريقة غير منتظم. هذا مزعج جدا. فبالتالي طالما قلب ما يوقف كفاية عشان يضغط الدم كفاية للمخ تبدأ يحس بإنه تقريبا تشاش كده ديزنس حاجات بالشكل ده. وطبعا هايبرتنشن برضه بيكون في هناك لأنه المخدرات ده بيأثر حتى في أجهزة تانية. إذا أثر في الكلى بتاعك فشو أنت هتبدأ في ضغط الدم وحتى التأثير بتاعه في بعض النيوروترانسميترز. النيوروترانسميترز هو المواد اللي الجسم بتاعك بيستخدم عشان يوصل إشارات. فإذا السبستنس ده بقى في الجسم بتاعك ممكن يجي جسمك ياخد إشارات غلط. إشارات غلط كيف؟ يعني بدل ما جسمك يوزن ضغط الدم في محل معين بيقوم يرفع فوق. لما يرفع فوق ممكن يحصل انفجارات في الأوعية الدموية، يحصل نزيف ويعمل ستروك وما شابه ذلك. المادة الثانية الناس بيستخدموا كثير اللي هو الكحول، مريسة أو الكحول. This one can, the alcohol can cause cardiomyopathy. ده حاجة معروف جدا عندنا في الجنوب كثير اللي هو التضخم بتاع القلب. القلب بيكون بدأ يكون كبير زيادة عن حجم ربنا خلقه وبفقد القدرة بتاعه عشان to pump sufficient blood to the systems. So for that, so many systems will start failing, even your brain, and this can also lead into stroke because قلب كبير because it is wherever دم بقدر clot فوق وبعدك shoot up into your brain and you get up in a stroke. برضو نشوف in respiratory issues اللي هو في الرئتين أو في الصدر. ناس بيستخدموا التمباك اللي هو السجاير ده برضو substance. and مارجوانا نتكلمنا عنه قبل شوية باختصار. بعدين crack ده very common طبعا معروف هنا ونقدر نسمع كتير crack. It is this cocaine mostly coming from South America. They use it for recreation. زول بيتكيف منه لكن بعد فترة you become addicted للاستعمال بتاعته. ده ممكن يحصل لك مشكلة فوق. This can cause chronic bronchitis. chronic bronchitis يعني التهاب مزمن في الشعب الهوائية أو القصبة الهوائية الكبار. ده تلقى زول قاعد يبوح باستمرار ويمشي للدكتور قاعد يقول له علاج لسه بعد فترة ثانية برجع يبوحها لسه مستمر. التهابات بتاع الصدر رئتين بيكون فيها التهاب باستمرار lung infections and increase lung cancer. طبعا once you insult any organ repetitively, this organ will have tendency to develop cancer. Like I think yesterday we mentioned something about the esophagus, where there are higher traffic of ingestion and things like that. Then other substance which is opioid, this can also cause very serious effect. We are seeing here, I'm sure if you go outside and then you hear siren, I could say 80% of this siren going around us here, trying to reach these people. Because this is the most of the commonest substance we use in this place. And I'm staying in an area where a lot of homeless people, a lot of these drug addicts, and these people of ambulance, they have no rest. They are just going all the time like that. And the system here, they have to go all three. The fire truck and the ambulance and the other people to go and investigate if there is a crime issue there. But it is putting very big burden on the system, on the economy of the country, and all those things. As mentioned earlier, this respiratory depression can kill. Other things also damage to the liver. This damage to the liver can come also because of the chronic use of alcohol. I think we know very well what alcohol do to our people, especially what we call suprigia, alcoholic people. When you continue to take this alcohol, you will develop something called fatty liver, alcoholic fatty liver. That means the liver will start losing its function and it start depositing fats into the liver tissue. And that liver tissue, when it becomes fatty, it loses its function and it starts to block blood circulation in the liver. Will lead to a situation called portal hypertension. That means irtifa في الدم بتاع الكبد. This is the fact that the كبد بيقوم يخلي دم الجاي المفروض يخش الكبد عشان يواصل مع عملية أكل ويجيب أكل عشان يوزعه. هنا الدم ده ما بقدر يمر بالكبد، لأن الكبد بقى شريك وبقى قوي وفوقه كله دهون. فبالتالي سكة الدم ده بيجي راجع ورا، بعمل يعني الدم بيرجع لورا، الدم ده بيرجع ورا بيكون قريب في لايننج بتاع intestine بتاعنا، especially في bottom اللي هو في stomach. That's why تبلغوا زول السكروجي شديد ويشرب رئيس كتير لفترة طويلة، كبد بتاعه بيكون بايظ والدم بيكون راجع وبيكون سكة الدم في جنب الستومك بعد دايلين وممكن بيفقع أي وقت. That's why كان فقع ممكن الدكتور يقول لك أنت كان كاسر تاني كان كاسر كوباية واحد بس أنت بكون خلاص. وفعلا بيحصل لي زول لو ترى الدم مرتين ده بكون النهاية بتاعه. وهذا الدمج اللي بيحصل للليفر نتيجة للالcohol consumption as a substance. Then alcohol also can cause gastrointestinal problem, which as we mentioned, this can cause gastritis, that's التهاب المعدة. Pancreatitis, this is one also difficult situation, التهاب بتاع pancreas, العلاج بتاعه صعب شديد. And بيحصل damage lining بتاع stomach. Then this lining can break up and causing ulcer and bleeding and cause death. There are other implications also in the neurological and cognitive change. These two terms, sometimes people use them concurrently, but they are completely different. Neurological is that ability that your central nervous system can give you movement, like muscular movement and even digestive movement and so forth. And even when you react, kind of below fight or flight. Adrenaline is surging, things like that. These are the things. adrenaline kan kamba mungkin kita تعمل معجزة. أنا مذكر بروفيسور تاني بقول المعجزات الناس قاعدين يعملوا أول حاجات very you cannot explain. مثلا نقول athletes they can run 10 kilometers. This one they just use 10 to 15% of their this adrenaline ability. But if you increase it to 20, you can even do wonders. That's why this system is very, very important. It is survival nervous system. Then the other side, which is cognitive, is our mental ability, how to process things, to process thoughts, to process ideas, and how to talk, how to respond to things. But these are two different things. You can be affected by two, or you can be affected by one. Your cognitive ability could be deranged, or your neurological abilities also can be deranged differently. So we see that long-term substance abuse can affect cognitive use, like memory, and loss of neurological, like ability of not doing something right, and dementia. Dementia, it is بعربي البسيط نقوله خرف. زول كان لكم كبير في عمر بعد مرات بنسيته بعد مرات بلغوا الكلام. This one is presbyterian dementia or aging dementia. This is different, but with alcohol it can happen. زول بيقوم يمشي بقى بيعمل حاجة بيقولوا confabulation. This confabulation يعني أنا مثلا بقول سمعت أنا كده قال لي Victor, I will repeat the same thing, but I didn't get the meaning. Itu kan ligosol bergamal cikal ajar zerena kot balak menu. Bukan yani kudra betau, वो kini situ, वो मांगर, वो gum ganti beteri kerja jenu. He repeat nafsal. Kalau mal terkelim Oh, binte na kita mungkin bahasa lautan, mungkin marah itu kan sudah. Substance abuse into psychiatric disorder, become بعض hasil psychiatric disorders. من ضمنهم ذكرناهم كثير anxiety, even personality disorders. Personality disorder أنا بتقول كل زول فينا عنده بتاعه. ما في زول ما قال ما عنده شوية. لكن ممكن يزيدوا ليه يعني مثلا بقولوا شنو ابسط مثال اللي هو الطريقه اللي انت بتتعامل معه مع ناس، الطريقه انت بتريليت معه مع ناس في النهايه بيجي تكون مثلا في عربي كده انا ما اعرف بنقال شنو، لكن يعني personality disorders انت بتشوف في زول socially هو بيكون مثلا ما عنده very close relation in a while تاني بيكون very close مع زول يلا انت بتشوف تقول زول بتاع مزاجات فممكن المزاجات ممكن يتغير لدرجه انه انا ما ادري اشوف زول I hate him يا تبصم انت ايه فلان انت وين انا ليه زمن انا ما شفتك ومار عجبني النودل. This could be also a cause. And depression اللي هو احباط الناس سمعين عنه شويه بيحصل و anxiety اللي هو قلق انت بكون قلقان ما اعرف شنو بيجي حاصل وانا بكون كيف و psychosis هو نوع من بعربي بسيط كده بنقول عنده كك يعني هو بكون بعمل حاجه مرات بصوره زياده عشان كده الديبريشن ده جانب الثاني بتاعه اللي هو مانياك اللي هو زول بيكون فوق وبعدين الديبريشن ده زول بيكون تحت. في ناس بتنام بصوره واضحه جدا اللي هو بيكون باي بولر كده بيكون باي بولر بيكون معاكم كويس هسه وبعد شويه ibaweza kulukulu. نجي هنا نشوف برضو السبستنس ابيوز بيعمل شنو للنيورولوجيكال اند كوجنيتيف. ذكرنا فرق بين الاثنين شويه تفاصيل تحت هناك. استعمال المستجيب للسبستنس or prolonged use of substance abuse can lead to cognitive impairment اللي هو قدرة العقلية. How to judge issues, how to respond, how to do that. Then memory loss. You can have memory loss, you can remember even the nearest event. So you cannot remember that. And this means it will take you near to dementia. You will start losing that memory ability, and that condition of dementia can persist and devolve into other things. The other ones which is up to now not confirmed, people talking about it, or Alzheimer's. This one sometimes they're related to environmental causes and things like that, but maybe, I'm not sure of that. Substance abuse can also lead to that. Psychiatric disorders. We are repeating here depression, anxiety, and psychosis. This is just to make sure that these are the things coming with substance abuse as a medical condition. Then infectious disease. That people could think that using substance could not be a source of infectious disease. We know that one of the routes we mentioned earlier of administering this thing is injection. And yesterday I remember I mentioned about the situation in East Africa. People inject themselves with the blood of others in order to get some substance to get high. This will lead to infections like HIV, other infections, hepatitis B, hepatitis C, and so forth. And we know from those names, now immediately you go to another system. From hepatitis A, B, you go to the liver. Liver is damaged and cause liver cirrhosis, and liver cirrhosis may lead to liver cancer. So it is vicious cycle. طريقة عشان تطلع منك سليم ما سهل. بيحبش أي محل في الجسم بتاعك to destroy it. That's what we try to share there, like sharing drug paraphernalia. Paraphernalia is the apparatus of using drugs. That's why I mentioned that list of administration. If you know the list of administration, then you know what are those paraphernalia. Is that injection, pipe, or whatever people use to administer those things. So people who are sharing those things, they will be distributing infection through it to one another. Maybe the pipe itself, it could be cause source of tuberculosis transmission. We mentioned about this, and substance abuse can cause impaired judgment. This is also connected to the cognitive function, and high probability of sexual transmitted disease. This is also due to either use these paraphernalia or medication, injections, and something like that. Now, let us see the implications of this substance abuse in other systems of the body. Our immune system can be impeded because of substance abuse. The common one which we can remember is HIV through injections. When HIV is transmitted from one person to another through the injection, this is now your immunity is impaired, then you are subject now to infections also, and then the AIDS itself as a disease. And this one, these are the ability of those substance abuse to reduce your immunity. Then we go to chronic illnesses. Yesterday we talked about it, and now we're going to relate it into diabetes. How could diabetes develop in somebody who's alcoholic? When we take a lot of alcohol, this will lead to pancreatitis, and pancreas is the organ which produces insulin in our body. Immediately we will get diabetes. Then also poor lifestyle. When you are just eating unhealthy diet, this will increase the risk to develop of diabetes as well through weight gain. Chronic pain. زمان ذكرت قبل شوية تمشي للدكتور يقول أنا تعبان الوجع شديد يكتب لك دواء فوق مخدرات ده والمخدرات ده بتزيد وجع وأنت هتخش في حلقة مستدامة ما في طريقة تطلع منه. We're almost there. And let us not forget other mental health disorders. When you use substances, we can, because they are always comorbid. Comorbid, that means they go together. They can affect our body together and cause these mental things. Like this could be very complex because when they are coming together like this, it will give a dilemma even in treating it. The doctor who's treating it will find himself in a dilemma. Like we sometimes hear that zone to double to into sugar. العلاج بتاعه بيكون مشكل. يعني تقدر تديه ملح عشان تنزل السكر بتاعه. انت بتعرف الضغط بتاعه. انت تقدر ما تديه هنا لكن هو بيكون محتاج للعلاج انك تنزل السكر بتاعته. بتلقى نفسك انك بتعرف الضغط. فبكون نفس الحالة هنا بكون دايلاما. وعزم التوازن شديد ويكون تحت العلاج بتاع الدكتور. So conclusion here, take away, we know substance abuse and addiction have wide range and huge impact on our physical health and mental health. That is through leading to chronic illness, severe health complications. Then the advice here is early intervention and comprehensive treatment, and we already heard that comprehensive treatment is not something of one day. It is really a journey of life. And support. This is also mentioned here, very important. You should know your support system, starting from your home, your friends, your spouse, your children. These are all support systems. We need them in order to overcome these difficulties. When we establish those three things there, we can achieve the other one on the right side here. Then we can be effective in improving overall health outcome.
And our doctor here. My question is in regard to the best way to tell the people whom we suspect that they have, say for instance, mental health or any major disease, but they are in denial. And then another one is about the youth. Nowadays also mental health is becoming common to our youth. You know, they lock themselves in the rooms most of the time. Parents don't know what is happening. They don't come out. How could that, how to approach them, or how to advise the people who are living in denial. They have a problem. For instance, I can give you an example, maybe sight problem, and then sight is connected with other diseases. Say, you know what, go get it checked. Oh, my eyes are good. And I'm there, juice. Shukran.
I'm going to speak because I work also as a community support. I deal with a lot of people, and as well as you guys have now learned my own struggle, right? A lot of us, and I would say us because I'm now part of that, because now you guys all know I struggle with a few mental health, but I am aware now. The best way I can tell you to approach that is with utmost empathy, because at the end of the day, the situation may not be real to you, but it is real to us who are going through it, whether it be little, whether it's a tall or whatever. For somebody who is struggling, that is profound. So if you come with empathy, and sometimes your gesture, body language, opens up or closes it. So when you open in a way that, I'm here, I care, I love you. If you approach from that place of love, or any kind of a hard heart, love can rapture that. We all know that. That is the weapon. When you come with love, when my husband, and he will come, Habibi, this is who you are to me. This is who you are. And when he says that, I will go to work and that thing will ring in my head. Oh, he says of this, he says of this, he says of this. But it's real. And then, what was the other question?
The denial,
Of course, the denial is, a lot of us deny it, but it is your love that will rapture and make us really realize. It's the love and the persistency, care. And your body language speaks louder. Actually, body language is louder than the words. Do we all know that? And it's stronger. So your body language, how you approach anything matters. When you're open, it will indicate to me that I am safe with you, and I can open up, I can engage.
Thank you. I think the question has been answered, and the good part of this for me is we are hearing it from somebody who went through it. That's why I say whatever scientific knowledge that we would bring will not be equivalent to what we are hearing from her now.
Thank you, Achaya. That was really a good presentation from both of you. I've got two questions, one for each. I'll start with you, Vicky. Thanks for sharing your whatever you're going through. So, for example, for our mothers who are going through mental health problems or depression, and they have been diagnosed, they don't want to take medications, what are other self-care techniques that can help them? That's for you. And for you, Dr. Victor, thanks for sharing your life journey as well with your back surgery and all that. I know you said you had high pain tolerance. They tried to give you opioids, you refused. What advice can you give to our community one day if they have to go and have back surgery or any other major surgery and they don't have high pain tolerance? Is there alternative therapy for them? Thank you.
I will go first. I spoke about the things that I have kind of built for me, and my journey may look different from others. But as a person, as a mother, when you're going through those waves, you tend to be secluded. You tend to want to be alone, in the bedroom a lot and things like that. So making conscious choice to engage. And that may be easy when we are not struggling with something as big as that. But when you're struggling, it becomes a choice. You have to make that conscious choice that today I'm going to wake up, I'm going to go for a walk, I'm going to write my gratitude journal. What am I grateful for? You know, simple things like that. Oh, my kids are healthy. My husband is healthy, he's working. He loves me. I have a job. Then you focus on what you love. And na Sudanese, Sudanese, we love to cook. You know? So finding the morale, hilwa takirubiri. And then I cook that every day. Pondu, aizola kanja fibete wa kumona pondu. Because I find that the smell of it relaxes me. And other things that I do, is I do deep breathing. You know, you may not have the knowledge like me because I work in the field. I know that, so I can engage in that at any point. I had it here so many times, nobody noticed, right? So I do meridian tapping. It's about deep breathing, breathing in. You guys Google it. Those my brain can't work. But I do meridian tapping, I do deep breathing. There are specific, if anybody wants details of it, now my brain can't work, I will be able to help you. Those simple techniques of deep breathing, meridian tapping, going for a walk, cooking, God. God is an amazing God. And knowing that He cares and He can carry your burden, give it to Him. He has surely carried mine, carry yours, all of us.
Yeah, thank you. I'm still answering some question. Yeah. To add to what you said, deep breathing, and so I think yesterday we came across something that maybe we skip it. This yoga. It helps a lot in stress relief and things like that. Then coming to my specific question. I think the way I will answer this is that I'm lucky because I have that knowledge. But what I would advise is that people should ask questions. And I expect the health caregiver to be there to answer those questions. Like, for example, don't just accept any medication because it is prescribed by a doctor. Ask questions like, gakodu kamara kiyom ulema bakodu wahid mara masala ulo gakodu wahid mara lema bakodu maratel posbo. The doctor will be there to explain. Then you ask question like dawden do side effects kanana kodu masala le zaman tawil. A doctor should explain this to you. Then you can also talk to a doctor, say, okay, wana kanama der dawden. This is one thing. The other thing which I know from nature of the body, it has not been that I have the high tolerance of pain, but I train myself to it. That's to say, at the beginning it was terrible. And nobody could touch me. Even it was a big problem between me and my wife. Because of course you know we are in one bed, how I turn myself as if she's the cause of that pain. Then I said, since I don't want to take medication, I should not punish her, but I should try now to see which way it will work. Then my body starts responding to what I want. Like getting in the morning is a big challenge, very, very, very bad. Pain all over my body, I cannot tell which part is not paining, and sometimes new pains will appear, which I had no experience the previous day. Then here, I will just reach a point where I say now, I have something I want to do. When I put that as a goal now, my body will shift all attention all to this, what I want to do. For example, say I have something on the computer, or I'm going to check my emails, or I'm going to respond to somebody, or I've got this research item I need to finalize it. Now my brain is all focused there. the pain will now sort of not there. Then I will start a normal day, like going to the washroom, take bath. By the time I come from there, all my concentration is what I'm going to do. Then I go and sit down and start doing it. My day is started, and you call me on phone, you will hear that Victor is nice there, nothing bad. I'm talking to you, I'm responding to your question. So my advice is, while undergoing this treatment, you ask good questions like, which one can benefit you? Then, from the knowledge you collect, you take that decision. Like, I had the knowledge, I know that these things were not good for me in the long run, I stopped it. I remember the medication written for pain after surgery, I stopped it the second day. And I was in real pain. Even going to washroom was a problem. Then my body slowly, of course, our body has got this threshold of responding to pain. Then my body start now raising that threshold, the pain will not reach there in very high intense. Then by time, I can say it becomes something normal. I know it comes and it goes. And I know how to put it off. It is a journey and a matter of training. As she said, it's not one day thing that today you say, I don't want pain and pain will not be there. No, it's not like that. It's a journey of life. Slowly, slowly your body will start responding and your body will become of that kind which does not respond to pain anyhow. Then you live your life.
Thank you for your knowledge that you guys share with us. Whatever you talked there, it was my question, but I can turn it around. My question now is about self-soap. You know, like sometimes we skip the medical medication that the doctor give it to you, and because of side effect, you will escape. You don't want to take it. And then for me, I will return it to my own way. Either I take the roots or take whatever I know that can help me. So my question now is there any problem with this one?
The question is there a problem with the milk?
You know, when, first of all, looking at the prescribed medication, when, I'm not a doctor, I'm not certified in that, but maybe Dr. Victor will attest to that. But based on my experience of working in the field, when a medication is being prescribed, we as people, we need to be careful kind of skipping and dipping it in and out into medication. You take this though, you avoid in the evening, and then you take another one, you avoid, you take another one. That is kind of giving your body some kind of an overload of this or that. I don't have the right terms, but the best way you could handle that is maybe go back to the doctor, talk about dosage. If this is not working for you, if it is a high dosage, talk about reducing it. And most doctors now, and again, yesterday they talked about we advocating for ourselves. If the doctor is not working with you and not willing to have those conversations with you, maybe they are not the one, the right doctor for you, and that's okay. So you find the right doctor, they need to engage with you, and doctors are more actually willing to work with you because at the end of the day, they want to see you start to improve whatever you're struggling with. They want to help you kind of work out of taking medication. But you are the advocate for yourself. Reducing the dosage could be other things. If we're going to take Dicaptimelo, I think a lot of us, I have Dicaptimelo at home. Sometimes I do take it. It's a choice. Because coming from Sudan, we all know that Dicaptimelo do help with headache and a few other things, and I don't know those other strong ones. But if that's your choice, that is okay. But when it comes to the traditional, the traditional pharmaceutical medication, please speak to your doctor before you change the dosage or meet administration time or things like that. Speak to your doctor first, but the doctor will.
Yeah, I quite concur with what you're saying, and my advice in such situation is that, and let me start by explaining why these medications are put in those regimen that take this in the morning and the evening, things like that. This is how this medication will be effective. That means when your body absorbs it, the medication undergoes certain process in the body. Some need certain things to happen first till they become active. Some they become active immediately. Then when we escape the medication, it is better sometimes. I'm not saying that it is always, but in most cases, if you cannot reach to your doctor, it is better to wait for another time dose. For example, if you are taking it at 8 today, and you miss this 8, don't rush immediately to take another one, because you will make interval between the 2 doses of this one and the coming one very short. So you can wait till the time of the next dose, then you start taking your dose again the same way the doctor said. And the best thing always, if you have that habit of skipping or missing your medication, always try to ask the doctor about that. If you tell me that let me take it 3 times, if I take it twice a day, and the 3rd dose I missed it, what will happen? He will explain this to you. And if I miss 2 doses, what will happen? He will explain this to you. In that specific medicine, because of this drug or medication, because not all medications are alike in a way of how they function in our body. In that case, each medication needs to be discussed specifically with the prescriber, the person who prescribed it. Then the other thing which I would like to add about the ketamine or any other traditional medication. This is an issue now. I myself have presented a very good paper about traditional medicine. I believe it. That's why I presented during my studies. I believe in this traditional medicine, and there are very good stories of traditional medicine. Let me say this, but don't count it on me. These traditional medicine, they've been there and very effective, but these pharmaceutical companies, they don't want you to use it because they will not make their billions. And they will always try to bring it up. If you do this, it is going to cause this and do this. But now, thank God that this traditional medicine is taking over. Like if you go, we have the Chinese one, they are doing good in that. We have South American one, they are doing good. They have people doing PhD in traditional medicine. So it is not something bad. The only thing is just how to either talk to your doctor to convince him this is what works with me. And because this is also there in Health Canada, that people come from different backgrounds. Sometimes these things we are finding in our pharmacies may not work with them. But if they find that this the thing works with them, good. Example is if you go to other communities now, they're using their traditional medicine. If you go to Chinese community, they're using it. If you go to Spanish, they're using theirs. So it is not a bad idea, but to be in safe side, you need to discuss it with your doctor. And you will reach consensus that this works for me. I need to take the mail better than any atenolol or something like that.
And I really apologize. I know that there are a couple of hands, but I think we're just going to wrap the session up for now. And I will encourage everybody, please interact with the doctor and interact with Vicky if you guys have any questions. Some of those questions are quite personal and sensitive. I know when it comes to mental health, a lot of people don't really want to be open about it, but now that Vicky is open, you guys can talk to her and she will be able to give you a few strategies on how to manage some of those things. I really appreciate you two guys for today. Thank you. Guys.